We are the Pennsylvania Manufacturers Association.
We are the Pennsylvania Manufacturers Association.
Business in Pennsylvania.
And business in Pennsylvania is our business.
Let's move to Medicaid. As we speak, we are still awaiting word from the feds as to your proposal, the alternate proposal for the Medicaid expansion dollars. Now, could that come any day now? Are you expecting it at any moment, or are we still
I can't say
away?
that I think it's coming today or tomorrow. The sooner we get a decision, the better for everybody. And, Brad, as you know, this is our proposal of how you need to deal with the Medicaid population here in Pennsylvania. Not in Washington, not in Washington State, not in California, because we're all different. And we think it works for Pennsylvania. It's part of our Healthy PA plan, which there are a number of different aspects to our Healthy PA plan. But this deals with Medicaid and reform of the existing Medicaid, right, because we spend a lot of money on existing Medicaid right now. One of the aspects of that, though, that I'd like to bring up is that the federal government a few months ago told us that they are going to reduce the amount of money that they're giving Pennsylvania and a few other states that they normally give us. It's called FMAP, that we normally count on. They just told us, well, we're going to reduce it by $370 million. That has a tremendous impact on the budget because we have to make up that difference. So as we move over into the expanded population, the population from 100 to 138% of poverty, they are going to be sending money to us over there. Mm-hmm. But just keep in mind, they took it from, in my opinion, they took it from other existing money that had already been given to us. Might be some additional money. I forget how much it's going to be, but we are down. Net, we're going to be down.
I want to talk a little bit about a House Human Services Committee meeting that was held this week. There were testimony from folks who find themselves in what they're calling this gap in coverage, where they can't qualify for Medicaid, they can't get in on the Affordable Care Act exchanges and such. I want to play about 45 seconds here of combined testimony from these folks, and we're also going to, in a little bit, play a cut from a lawmaker who's trying to explain a lot of what you've been explaining on this show. But here's what some of the folks had to say.
I just believe that if a person works hard, then they should be able to meet their basic needs in life. So I just feel as though government Corbett's decision to not accept the Medicaid expansion has got me at a disadvantage here.
I am one of hundreds of thousands of individuals in Pennsylvania who are stuck in this coverage gap. Consider how frustrating and frightening it is to live without health care coverage, not having the preventive care that we need.
It just seems to me that working people shouldn't have to live like this. We work, we pay taxes, we contribute to the economy. We deserve to be able to see a doctor for preventative care and when we're sick.
That was Carmela Green, Keena Hicks, and Theodora Morley, who all had their chance before that committee. Before we get, I want to play a cut from Brad Roy, a state representative as well. But before we get to that, talk to them. Tell them what you're doing and how it fits in with what they need.
Well, Brad, I have to ask you, when you said that they're in this gap, are you talking about, and I'm not sure from that, are you talking about the gap of the 100 to the 138% of poverty? Because that's what the expansion goes to. Mm-hmm. And that's what the federal government would like us to take. And when the one individual said we should have just expanded Medicaid, that's what that is. Or these individuals who are above 138%.
These are the folks, I believe, who are above, but they can't qualify for either one, and there's just this middle area where they're stuck.
Well, let's go back. Healthy PA is going to affect those in that 100 to 138%. The one individual said we should have expanded Medicaid. That wouldn't help. Even if we took the expansion, it would not help those people above 138%. And right now, I don't believe the government at the federal level, because I'm sure the president, if he felt that he could do that, would go higher than that. And certainly right now, particularly with the budget issues of Pennsylvania and the other states, that we can address anything in that gap. We right now, today, in our budget, Health and Human Services related type issues, the Department of Welfare, some of the Department of Health, some of the Department of Aging. The percentage of the budget of our $28.6 billion budget, $28.4 billion budget, is 38.9%. It's second only to education at 40%. And the projection is, or was, or we don't know where it's going to be, that both of those would grow somewhat.
That's one that grows every single year.
And it does. It grows every single year, along with the pension issue, grows every single year. And it's, all of them are almost unsustainable down the road distantly unless we get some reforms. And we're looking to get those reforms in Medicaid for the basic Medicaid that we've been providing for many years, because we have been spending on many items that are hardly being used. And we had the second most generous program in the country, second only to Missouri, and considerably higher than the averages, even in the states that surround us. So we would like to meet everybody's needs. But, hopefully, and this is what I understand, the goal of the Affordable Care Act, Obamacare as it's known, was to get to the people that you're talking about, that these people that just testified, was to get to them that they would be able to go on the exchange. Now, before I came here, I'm reading the newspaper, and you probably read it, to see what all the insurance companies who were forced to get into this are going to do with the premiums for next year. And there's considerable fear, and probably justifiable, you're going to see premiums go up for everybody. Well, when they go up for everybody, they're going to go up for all the public sector employees who are paid. Many of theirs, health care is paid for, the teachers, everything, or at least a portion of it. They're all going to see that go up. So there is an effect on all of this.